Dr. Andy McGee, cardiothoracic surgeon here at Ozarks Medical Center. Been here about 4 to 5 months as part of a concerted effort by the hospital to enhance many of its services, and my part is integral in relation to heart care services. I've had a great experience just in my short time here, and I've seen a lot of great interaction between staff, both at skill level and communication. I'd like to share a brief experience I had about 3 weeks ago. We had a patient who had cardiac surgery, valve replacement, and had a usual uneventful early post-op course, and then was transferred to the ward to finish up his care in the hospital for about 3 days. Nurse upstairs noted very astutely and very quickly the patient seemed to be having some difficulties. She made a very rapid, quick assessment, contacted some of her colleagues as well as myself of her concerns, and in a very short order we had the patient back in the ICU. Both with our ICU staff as well as the nurses on the floor came down as well to assist. We had respiratory therapy and all the other ancillary personnel helping. We discovered in very short fashion that essentially the patient had a delayed presentation of cardiac tamponade. And so essentially in a matter of probably less than 2 hours, the patient went from stable to diagnosed distress to transferred to a higher acuity care to the operating room where tamponade was relieved. Patient immediately stabilized, returned to the ICU, and in a matter of about less than a week was home with really no sequelae. And I think this shows several things. First of all, it shows just the outstanding care the patient gets from the time they hit the door through all the various facets of care, including ancillary personnel from laboratory to respiratory therapy to physical therapy. It shows great communication, which I know the administration and all our departments frequently concentrate on and reemphasize. And so I think the integral nature of how this worked was ideal, and you would not have found any better response to a difficult situation in any facility that I've ever been at or even can think of. And it shows in a patient who's done exceptionally well. I've seen the patient in the clinic twice. He's essentially returned to near normal. Patient and family feel like they have had a great experience here at OMC. And I think it's a wonderful example of top-notch care, great personnel both individually and then work as cohesively as a group that results in outstanding patient outcomes.